What if the reason you wake up exhausted isn't your mattress, your schedule, or even stress, but the way your tongue sits in your mouth while you sleep? If your mouth shapes the way you breathe at night, could better sleep and better health start there? We're kicking off a three-part Well Wave Now series with Heather the Hygienist, a biological dental expert and airway advocate who's helping people see oral health as the gateway to whole body wellness. Heather, before we get into fatigue and oxygenation, what exactly makes biological dentistry different from what most people think of as traditional dentistry?
Well, thanks for having me, Tim and Breck. It's great to be back. And you pose an excellent question because people don't realize that there is a difference with biological dentistry. And I think general dentistry is just so focused on the mouth as a compartment. Biological holistic dentistry focuses on the whole body and
Okay.
looking at the fact that everything is connected and getting to the root cause of things instead of just trying to treat the mouth. So I think there's just a huge misconception when it comes to teeth in general, because people seem to think that it's not connected to the rest of our body, but actually, you have one tube, it starts in your mouth and it goes all the way out you. So if you have disease or infection in the mouth, it doesn't just stay in the mouth. Your mouth is the most vascular part of your whole body. So, it gets into your organs and can seriously affect your systemic health.
All right, beautiful. So that's the type of wisdom we like here on Well Wave Now. So I want to remind all our guests what you're doing now is you're watching Well Wave or listening to Well Wave Now, where timeless wisdom meets modern insight to help you live better and hopefully for longer.
Yeah. So, I wonder how many of our listeners are waking up groggy or a little bit foggy and they're not even thinking about looking at their mouth. That could be the reason, right? Is the mouth. And so, jaw width, tongue position and the posture, and how much oxygen you're taking in at night. Really, if there's any restriction there, no amount of sleep is going to fix that fatigue, right? I'm excited to get into this topic with you today because that's something that I think I've fixed in my own life. I'm waking up before the alarm goes off now.
That's great. I'm glad to hear that. Unfortunately, 80% of sleep apnea is really undiagnosed, I should say. And I think airway health is more of a newer field. So you would think that in dentistry, we're actually really trained to look more at the myofunctional side of things, but it's a separate certification.
Now that's a big word there, Heather. Myofunctional. Come on now. What you got to remember? I'm just a small town, central Nebraska kid. Didn't learn that myofunctional stuff. So
Yes.
what's that mean?
Kind of a fancy term for, how you have physical therapy if you have knee surgery, right? You go to a physical therapist because they'll retrain you on how to use your muscles. Myofunctional therapy is basically physical therapy for the jaw, the mouth, and the tongue. So it's something that, like I said, is more of a newer field. So it's not hasn't been taught in your conventional dentistry. And hopefully it'll become more mainstream as time goes on. But people will say, well, my dentist never even looked at my tongue or tongue posture, never discussed this with me. And it's just because we're not really taught. There's the Breathe Right Institute led by Dr. Zagi, and then you have the Tongue Tie Academy by Dr. Baxter. Those are really only the two outside sources that I know of that even train dentists to look specifically for myofunctional issues. And that means we have four goals basically in myofunctional therapy, and that's nasal breathing 100% of the time, lip seal, lips together 100% of the time, proper tongue posture, so your tongue should not lay on the floor of the mouth, but up on the roof, and proper swallowing. A lot of times people thrust, when they're swallowing, they thrust their tongue forward or out the sides, and that can create myofunctional issues. And
Okay,
all of this
let-
can be
let's give folks a little way to. I know you got so much knowledge there, Heather, because I want our audience and people to take a look and see if they can you know identify a little bit in their self in this. So let's all three of us and everybody listening out there and watching. I want you to just try a little thing here. So let's close. You talk about the nasal breathing and the part about the swallowing. So let's just close our mouths and breathe through the nose for a few seconds. Now, if people doing that, if that feels hard, or the mouth wants to open, I'm sure Heather will give us some other signs here, but that's a sign that that airway might be compromised. So let's talk about that, Heather, a little bit. logically, what's happening there to people? I know you talk about what we checked for, but what's happening in the environment if that feels hard to somebody?
So there could be a possible structural issue, say a deviated septum or something that might cause blockage, but you can actually test one nostril at a time. If you are able to successfully get air in and there's not an issue with the turbinates or anything, and it's not a structural issue, it could be a bad habit of mouth breathing. Also, it could be because the tongue, which everyone has a frenum, which is the attachment from the tongue to the floor of the mouth, sometimes that attachment, that frenum, is too tight. So if it's too tight to the floor of the mouth, it prohibits you from being able to physically put your tongue where it needs to be, and it can constrict the airway. So we kind of have a combination of things going on. We can have a structural issue with the nasal passages that might be preventing proper breathing through the nose. It could be a bad habit. It could be because the airway is compromised through the tongue with the posterior tongue tie. So you'd want to be evaluated by someone that is a myofunctional therapist or a doctor or dentist that's been through one of those two certifications that I recommended.
So I think for people, one thing that could be key is to have a view of how common are these disorders? How common is mouth breathing during sleep? How prevalent is this really, Heather?
It's a really huge problem, actually, because people think fluoride is the answer for everything, why they keep getting cavities. But really, mouth breathing and dry mouth is the number one cause of decay. So, if you're breathing through your mouth, your saliva isn't able to do its job, and that is to be a natural protectant. So, you're drying out your oral tissues, which can exasperate the bad bacteria from it really just makes everything out of balance, your oral microbiome. So then the bad bugs kind of take over and can create dental decay, cavities. So if you're somebody that is dealing with maybe even gum disease, breathing through the mouth can create inflammation, bleeding of the gums. And mainly too, if you're waking up in the morning and you're not well rested, if you're constantly waking up, if you're have brain fog, I would definitely suggest a sleep study. I feel like that's a really good first step to see what's happening while you're sleeping, in addition to being evaluated by the right provider to see what the root cause is.
So when we're looking at that connection, you would think your mouth opening is larger, so you could take more oxygen in through your mouth. But you're saying that, man, that airway connection really should be through the nostril, through the
Well,
nasal.
there's nothing about your lungs that is designed to filter air. If you breathe in through your mouth, it can take like 65 days for your lungs to filter the air that your nose does in 15 minutes. And then you don't get any nitric oxide. So you get this imbalance of CO2 in your lungs because you're actually overbreathing. So if you were to try to strictly nasal breathe or put some mouth tape on your lips for 5 minutes, and after that 5 minutes, you want to rip it off, it's because you're overbreathing and you have an imbalance of CO2 in your lungs. So now we would need to figure out, is it because you have a posterior tongue tie, your airways being blocked because your tongue can't get into the right position? What is the root cause of that? So you want to eliminate the actual issue that you're having so you can breathe properly, because if you're not getting nitric oxide, if you're not getting oxygen while you sleep, that's kind of the number one nutrient your body needs, and not getting enough oxygen at night can cause cardiovascular issues, IBS, attention deficit disorder in children, autoimmune problems. So it's a whole host of issues that can develop, from the time that is a baby really developing into adulthood. If you can catch these things while that child is developing and look for the signs of sleep disordered breathing, then you can really just not have to deal with so many issues later on in life that affect the health negatively.
Yeah, I'm kind of addicted to oxygen. I don't have
Yeah.
any other vice that I really need, but oxygen's one thing I really am kind of addicted to.
Yeah. So that nasal breathing is super important. You really need to get the nitric oxide. And, like I said, your lungs are just simply not designed to filter air.
So you talked about all the issues that kids can have from it. So what kids specifically are those early signs that a parent should look for to say this may be something on the an airway problem, an issue, tongue posture?
If your child is snoring, if your child is clenching and grinding their teeth, sometimes their grinding of their teeth is so loud. That's another sign that your body just isn't getting enough oxygen because your body's trying to open up your airway through the grinding. So, and if you look in on your child and their mouth is open, clear sign. So this is going to affect their development with even their facial structure, because as your body's trying to compensate for air, so your child's face will get more elongated this way as opposed to this way. So if the airway is healthy, you get that nice wider jaw, which is a healthier airway than someone that's compromised with the vertical dimension. So we really want to be catching this when they're young. As they're developing, we can be expanding things so that way their airway isn't compromised.
This might get back to what we were talking about earlier, but I'll ask this anyway. Why do so many people, you think, blame other things? Blame stress, blame hormones when they talk when that
Mhm.
airway is the root problem.
Well, I think it can be, there's not like one magic bullet. I think it's a whole systemic thing. We really, and that's what I love about biological dentistry is we look at the whole picture. We evaluate how you're breathing. We look at everything. So, and again, it's not just one thing for everybody. It could be a combination of things. Maybe it is hormones, but still we need to have that evaluation done properly on, a CT scan of like what's going on here. I mean, if your tongue is constricting your airway, that's going to show up on a CT scan, but you also have to have a provider that knows what they're looking at and is familiar with myofunctional therapy and airway health. As like I said, and it's not something that is quite common yet because it is a newer field. So you might have to do some research on a provider near you.
So is that extra training that goes into to
Yeah.
that? So that's why it's not covered in every dental appointment today, which I think it should be, right? And you
It
probably feel
should
the
be,
same.
but
Yeah.
yeah, it's just not taught, and that's why I said there's really only um, 2 institutes that really focus on this post-education for dentistry and for dental hygienists as well. Speech pathology, they can also take the course as well to become a certified myofunctional therapist and have a dentist that knows how to properly release a tongue tie. You don't want to just have someone go in and say, "Oh yeah, I can take my little laser and just cut that frenum." That could actually make things worse if you don't have enough tongue space. That could be disastrous. So you really want to make sure that you are with the right provider because there's many aspects that need to be considered before you go ahead and just do a little minor surgery there. Perhaps we can do some things with myofunctional therapy, which, like I said, is like physical therapy, trying to strengthen the tongue, the muscles. Everything is muscles. I mean, your tongue is the strongest muscle. So your teeth are soldiers, they're going to go where that tongue dictates. So if you're also someone that's had braces a few times and you keep relapsing, your teeth keep getting all crowded, it's improper tongue posture. So these are things that we really need to hopefully broaden people's horizons on, and they can start asking the right questions. And maybe over time, hopefully, that things will become more mainstream.
Okay. So thanks, Heather. So now that we've kind of got that foundation that you laid for us and understanding the link between the airway and health, let's do what you do and look inside the mouth itself. If the teeth keep readjusting, and what that can mean, and that might lead to something called the scalloped tongues. We touched a little about grinding the dry and you drop dry mouth and the receding gums, and all those kind of point to some nighttime oxygen lost again.
Yeah, and I'd
Yes.
also love to hear a success story, maybe somebody that had come to you with brain fog and they were just tired all the time and they didn't think about that it being their mouth that could be the cause of this. So you'd love to hear some success stories.
I actually posted a success story on my TikTok because it was really phenomenal. Just one day after his tongue tie release, the difference in his posture alone was incredible. And he was chronic mouth breather, had braces a couple of times, teeth kept relapsing, and he's 18. So his mom really reached out to me and was just really desperate because, before he went away to college, they wanted to get this fixed. So we were able to, I work with a doctor, Dr. Casey Lynn in Apollo Beach. He and I work pretty closely together. So he evaluated him and said, yeah, you're like a grade 4. Grade 4 is bad. Grade 3 is bad. Those pretty much need to have surgical interventions. Class twos, that's what I am. Those are a little bit trickier because a lot of times some, surgery may or may not help. Usually myofunctional therapy is pretty great for the class twos, but he was a grade 4. So that's pretty much as bad as you get. He could not lift his tongue up to the roof of the mouth at all. He wasn't sleeping well, just attention deficit issues. And working with him, surgery pre and post op, you can see on my social media the immediate change. Just he feels so much better. He's mouth taping every night and can wear the mouth tape successfully all night long without any issues. So he has now learned how to breathe through his nose successfully. He's keeping his tongue up where it should be. Of course, it takes time, like anything else. Muscles take time to relearn, right? So we usually space our appointments out about every 2 weeks. And it doesn't take much time. It's like 5 minutes in the morning, 5 minutes at night. And you usually have like 3 active exercises. And what I mean by active is you have to look in the mirror and watch yourself. Because if you're like, if you're getting neck engagement, if you're shifting your jaw, those are all things that you need to look for when you're doing the exercises, because we don't want those compensations, we call them. So learning how to do the exercises properly, it's just amazing what you can do to
So,
really strengthen the throat and everything.
what type of exercise? Give us an example of those exercises.
Well, one exercise is called lingual palatal suction, LPS for short. And it's where you take the tongue and you try and, I don't know if you can see, where you suction the tongue up to the roof of the mouth. And so some people can't even do that. They can't even get their tongue. They might be able to get the tip of the tongue up there, but they can't get the back of the tongue. So we practice with that. And then there's tongue points where we take the tongue and we just go corner to corner, but we keep the jaw still and we don't engage the neck. So we start out, each exercise kind of builds on one another. And like I said, it's just about 3 active exercises twice a day, every 2 weeks. And then we just keep going. And it's about 12 sessions or so. Sometimes you might need a couple more, but usually about 12 sessions is really good. I haven't had anyone so far that needed additional therapy, but it can be really life-changing, because what people don't realize is the fascia that's underneath the tongue, that frenum, it's one piece all the way down to your feet. So, and when I say it's tight, I mean, it can be, when it's tight, what you'll do, your body compensates with this forward head posture because your body's naturally trying to open up your airway. So that can create neck problems, TMJ issues, because again, the body's compensating because it's really trying to get oxygen. Some people, in fact, Dr. Zaghi at the Breathe Right Institute, he's got some really great before and after YouTube videos, success stories of especially women that have just felt like after they had that tongue tie release, they just feel like so different. And that's not with everybody, but I mean, there are some really amazing success stories out there.
So Heather, I'm gonna pull a Tim Daniels on you and ask you a 2-part question, because he's famous for those, right? We kind of mentioned scalloped tongue. So explain what a scalloped tongue is, and then what does that actually tell you about how someone's airway is working?
Well, it could mean that they don't have enough tongue space. So it could mean that the
Well,
arch itself is
hold
too.
on, though, Heather. Remember the first part of Black's compound question, which
Scalloped
was
tongue.
what
What is
really
that?
is a scalloped tongue,
Right, I'm trying to get to that. So what
Okay.
happens is if you're more narrow up here, right, and you're not able to get that tongue up onto the roof of the mouth, it's going to hang low on the floor of the mouth. So that means it's going to have more of a scalloped ridge because it's not fitting up on the roof of the mouth. It's hanging out low. So now it's where it shouldn't be, and that's on the floor of the mouth. So it's trying to fit in this space here because it can't fit up at the top where it should be. That's why we want a wider arch so that tongue can get up comfortably to where it should be, so that this arch isn't so narrow, preventing that tongue from being home, so to speak, if that makes any sense. So you just don't want your tongue on the floor of the mouth. It belongs up on the roof of the mouth. So that's why we call it low tongue posture.
So do you discover that by the shape of the tongue, by the spread of the jaw? What?
Well, you can see ridges on the tongue,
Okay.
or if someone is, I'm always looking at I always have them lift their tongue. I always look at to see if there is scalloping, to see how much tongue space that they have. So this is something that I do when I am evaluating my own patients. But, sadly, like I said, it's kind of something that people haven't heard about. So they're kind of like, what are you saying? I've never heard about low tongue posture and no one's ever mentioned this to me before. So hopefully, it is something that's going to just become more mainstream over time, maybe more social media posts and just knowledge in general as far as,
And do those go hand in hand then? The ridges on the sides indicate the lack of oxygen or the blocking of the
well,
airway?
yeah, it's going to tell me that their tongue isn't where it's supposed to be. So then we need to look at whether or not are they able physically to get that tongue up to where it needs to be, or are they a grade 3 or a grade 4 where surgical intervention is more than likely. Sometimes when they're younger, we can do orthodontic work to try and do some palatal expansion. This is the palate up here, so we try to expand the upper jaw as they're growing so we can create more tongue space. And then you have to train them where home is for the tongue. So it's a new position, right? They're so used to keeping their tongue on the floor of their mouth, or they're used to sticking their tongue forward when they swallow. So there's different exercises that we need to do to retrain the tongue and just create new brain patterns.
Yep. So let's take those. Let's talk about why that should be done some more. Like, you talk about some of the things early on that could manifest with people, attention deficit, other things of that nature. Why should I really care about my low tongue posture or other things, Heather? What type of symptoms are, and you also talked a little bit about how people could look for it in their kids if there was grinding, if the mouth was open, if there was snoring. But how's this stuff really impacting my life if I have these problems?
Well, how's your sleep quality? I mean, are you sleeping well? You feel well rested in the morning? Do you have a lot of recession? Do you have TMJ issues? Do you have neck pain? I mean, these are things that, can seriously affect the quality of people's life. If you have a lot of root exposure, that can create extreme sensitivity for people where just breathing in air is uncomfortable, can't have anything cold, not to mention doesn't look good, especially if they smile and you see the long in the tooth look, So there's a whole host of issues as to why you would want to get to the bottom of something, and it just based on someone's health, how they're feeling in general.
And then you mentioned in the one kind of thing you took us through in the success story that it changed the person's posture. What's the connect now? Is that the oral posture or that was his physical
It was
spinal
his
posture?
Yeah, it was his physical posture. Like you could see his forward head posture in the first picture, and then he could really stand up straight after the surgery. And he thought he was standing up straight prior, but he could
Mhm.
really feel the difference when he got that tongue tie release. Wow, I feel like I'm actually able to straighten up. He was also having TMJ issues from that forward head postures. You know, everything is connected. The whole body is connected. So it's really exciting to be able to help someone that was having issues and didn't even really realize the cause. Now, in that 18-year-old's case, he actually had a tongue tie release as a baby. But see, what can happen is that scar tissue can adhere back to the floor of the mouth and make it worse if you're not doing exercises and things to help release that scar tissue. So that's why it's really important to make sure that the right therapy is provided moving forward. Otherwise, you can end up worse off.
So, Heather, it may be really common sense, but I think common sense isn't so common anymore. So, remind our listeners what the mouth-based issues can translate into for daytime symptoms.
If you're clenching and grinding your teeth, if your teeth are together, your tongue is not where it should be. So if you find yourself clenching your teeth during the day, stick your tongue up to the roof of your mouth. That separates your teeth immediately. So you want to definitely bring that up to a conscious level. But if you can just be mindful of that, a lot of times you get that your teeth become shorter over time if you're really grinding your teeth. You lose the vertical dimension of your teeth, which can cause other issues. I mean, does anyone want to spend all their money on dentistry with having to put crowns on every single teeth? I should say that's very expensive and it's avoidable. If we can definitely do some intervention prior, hopefully we can avoid some of those.
Not to mention the tired, the brain fog,
Oh, for sure.
mood.
Yeah. And that's where a sleep study kind of comes into play because it really helps. And and I should specify, a lot of women actually have what's called upper airway resistance syndrome, which is UARS. So if they were to get a sleep study, unless it's a polysomnogram, I know that's a really big word, polysomnogram, it's not going to necessarily pick up on any of the upper airway resistance syndrome. So you would need a specific test for that because women are just different in general. A lot of women have this, and it's just, pushed off as, oh, you're a mom, you're working full time. No wonder why you're tired. They might need a polysomnogram test to determine if they have an UARS and have an underlying tongue issue, an airway issue that's preventing them from getting the rest that they need, but it may not be bad enough to classify as. So I just love it when people get sleep studies and it says, oh, it's mild apnea. You're only going without oxygen a few times a night. That's no big deal.
Yeah.
It is a big deal. And someone that blows it off is not someone you really want as your provider.
How expensive are those tests? Is it the dentist is going to spot it and say you need that test? Are they going to go and if, like I said, they go have a sleep test and they say, oh, it's no problem. Why would they? Who's going to help them understand what's the cost, and who's going to help somebody understand that they should continue to pursue that and get that test, Heather?
Well, a lot of times sleep studies are covered under medical insurance, not
Mhm.
even dental. A dentist can prescribe a sleep study, and that dentist would have to be well versed in understanding myofunctional issues. So, if you're looking for a really good provider, I would go to the Breathe Right Institute. I would go to the Tongue Tie Academy and look for a provider near you because you do want to be evaluated by someone that has this training and has this understanding. So, that would be my first recommendation is find the right provider. They can provide the right recommendation for a testing on whether you need either a traditional sleep study or you need a polysomnogram. And these can be at home studies. It doesn't have to be where you are sleeping in some sort of a, weird place. You can get these studies done in the comfort of your own home, both of these studies. So I think that's a great advancement in technology today because I don't think you would be accurate for me if I'm having to go to some sleep lab. I just would not sleep. I mean, I have to be in my own bed with, my own pillow and all of
Yeah.
that stuff. So I don't feel necessarily a sleep lab is the greatest. If you can do it in your home, I think that would be a better result overall. But finding the right provider is going to really be the key.
Is there a direct correlation to lack of oxygen and the individual that's snoring? I mean, is that an indicator, hey, you need to go get one of these studies done? They're
Absolutely.
snoring. Okay.
Yeah, that's really sleep disordered breathing. Snoring is really not normal. If you're really rasping and snoring, gasping for breath, that's a serious issue, and it will stress the heart out. So high blood pressure is a big one. I have a 17-year-old kid whose blood pressure runs around 150 over 98. Okay. And it has been strongly recommended that he get a sleep study. But his pediatric doctor says, we're just going to watch it. I, I think that that's terrible. I mean, every single time he comes in, his blood pressure is super high. He's 17. I mean, this is like, and I can tell he's got a grade 3 tongue tie. The kid needs, help, but his pediatric doctor doesn't think it's any problem. And so, that's kind of what you're up against is just the lack of awareness and education when it comes to how serious this can be. I mean, it's a cardiovascular issue waiting to happen.
Yeah. Well, in our next segment, we're going to actually look at real solutions for better energy and sleep. But before we get to that next segment, I want to thank our sponsor this half hour, BioLite. So recent studies and surveys show that 75% of Americans are chronically dehydrated, probably 90% here in the desert. And BioLite is the only medical grade hydration drink out there. So everything you would get in an intravenous IV, but in the convenience of a drink. 650% more electrolytes than the leading sports drinks. BioLite is family owned and on a mission to help people feel better fast. It's amazing. I wish I would have had this back when I was training for marathons. It would have been a tremendous help, because it's always, when you feel thirsty, it's too late. You're already dehydrated in a race. So we'll leave a link in the show notes if you want to discover this amazing clinical grade hydration. So, Heather, now that we've kind of discovered that the issue may be in your mouth and why you're feeling a little bit sleepy, what are some things, before a study could be ordered and go through that sleep study, what are some things that our listeners could do tonight to help them get better sleep?
They could try mouth taping. You can get that off of Amazon pretty cheaply. And it's just a little sticky tape that keeps the lips sealed. You can try that and see how you feel. Because, like I said, if you're going to rip it off after 5 minutes, that is your tell all sign that you definitely are over breathing and might have an issue. But you could try
I've
some
got
mouth.
to admit that seeing pictures of that, I thought that was, a hoax, like a spouse trying to silence their loved one or something like that. But that really is something that we should be doing then.
Yes, you want that lip seal.
Okay.
Those lips should be together. They should not be open. If your mouth is open while you're asleep, what can happen is the lungs can suck air in, and then that keeps you in a state of fight or flight all night, which that's, your body is not able to get into that parasympathetic state, which is rest and digest. So that's what we're looking for, is we want to get the body into parasympathetic state. So how you do that is the lip seal, the nasal breathing, so that way your body can repair itself as it's meant to while you're sleeping. So if you're never able to get into parasympathetic and you're constantly in fight or flight, is it any wonder why your body would be having high blood pressure and all of these other issues? Because it's not getting the rest that it needs. So they could try the mouth tape. They could try to get the tongue up to where it belongs. And on my website, I have two websites. I have my simplysilvermouthwash.com website. And I also have my myologywellness.com website. You can get to Myology Wellness through my Simply Silver, but I have some really great videos at the bottom of the website that you can watch. It's very educational, and hopefully it will answer some of the questions. I know we did talk a lot about things that people aren't used to hearing with some big fancy words. So I would just encourage people to watch the videos and hopefully educate themselves a little bit more. And they can always reach out to me as well.
Great. So you've given us those things we can follow up on, and given us the tip that people can take action on tonight to try if they think they're having some challenge. Now let's dive back into you and others as a specialist in therapy there. And we touched upon it, but we touched upon a lot, so we got to really just drill down bit by bit here now. So now let's talk about this myofunctional therapy again and how it helps retrain the breathing patterns.
Well, again, there's the four goals that you're trying to do, and that is, we've already mentioned that, but all of the exercises are
But
geared
it'd be good to repeat those 4 goals.
nasal breathing 100% of the time, lip seal 100% of the time, proper tongue posture, which again is up on the roof of the mouth, not the floor, and proper swallow. So we don't want that tongue being forced out, which is called tongue thrusting, and we don't want the tongue going out the sides, which is another form of tongue thrusting. So a proper swallow. So all of those exercises that we do are going to be focusing on those 4 pillars. That's the goal of myofunctional therapy, is to do all of those things. Sometimes we can accomplish that without surgery. Other times, surgical intervention is needed. That's why you have to work with both a therapist, a myofunctional therapist, and a provider, a dentist, that could perform that surgery if need be. So the two work hand in hand, but that is the ultimate goal of myofunctional therapy, is to correct those 4 things we just mentioned.
Excellent. Now you'd talked briefly about the microbiome in your mouth. I wanted to get into that a little more, and also how does inflammation, where does that come in to the whole ecosystem in your mouth and keeping that, your oral microbiome in check? And what are some signs that we can watch for?
Well, we definitely don't want any bleeding. Bleeding might be common, but it is not normal. And so that is a sign that oral microbiome is out of balance. Everyone has bacteria. both good and bad, about 800 different bacteria actually in the mouth. And like I said, you have one tube, it starts here and it goes all the way at you. So you have a gut flora and you have a flora in your mouth. But this is really where everything starts. So if you're getting bleeding, that's a really bad sign. If you're getting cavities, again, that's a sign that that oral microbiome is out of balance. Your gums should be pink and firm. The bone, which is holding your teeth in place, needs to be healthy. If you have periodontal disease, which is rotting bone in your mouth where the gums are all infected and you've got bone loss, that's a very serious issue that definitely needs to be addressed. So we definitely want to look at all of those things together and find out what is the root cause of that oral microbiome being disrupted. Is it maybe parasite related? Do they possibly have a mutation, a gene mutation? You guys have probably heard about this before. MTHFR. That is a mutation that almost 50% of the population in the United States has. So that means your body might be more inflamed. Could be that you are not detoxing properly and you might need methylated vitamins for your body to absorb things. So there's root causes to what's going on. But the mouth, if you look way back when slavery was available, what would they always do to that person that was being sold into slavery? They'd look into their mouth, right? You can tell if there's massive decay, all kinds of stuff. They knew that that person was sick. They didn't want that person because that's the sign of their overall health. So we can tell very quickly when we're looking inside the mouth. Within 2 minutes, I can tell you what kind of health that person is in. If they've got bleeding gums, if I touch their gums and their gums are bleeding, that's a sign of infection. So we really want to think about ways to balance the oral microbiome. You can do that with probiotics. I do like the Probiora chewable one because it specifically kills the bacteria Streptococcus mutans. That's the bug that causes cavities. So a chewable probiotic is great. Supporting your immune system, of course, brushing, flossing, going to the dentist.
One of the things, so I think that's great as you talked about and this what we asked about inflammation and bacteria and overall health effect on that. But one part we're really zoning in a little bit on on the airway and breathing issues a little bit here today. So one, that inflammation and bacterial and microbiome in the oral part being off, will that, even if it's does that impact the airway and breathing? And even if how severe does it, if it does, how severe does it have to be to impact?
Well, as I mentioned earlier, if you're breathing through your mouth, your saliva isn't able to do its job. So is drying out everything. And that's going to show with either exasperation of, bleeding, maybe even tartar buildup, decay.
Right, but does the bacteria in your mouth impact that?
Well, that's why you're getting those things, is because there's an imbalance of bacteria. So we want to fix the oral microbiome. We want to be able to make sure we're treating the root cause to get that oral microbiome back in balance. So it's going to be in balance if you're breathing through your nose, if your lips are together. Your saliva is going to do its natural job of always remineralizing your teeth. That's its whole goal. If you are taking a lot of medications and you've got a dry mouth, again, dry mouth is the number one cause of cavities. So it's a disruption of the bacteria in your mouth. So if you're doing something like the chewable probiotic, it's going to help with the flora in your mouth. So just
Okay.
doing that one thing is super helpful. And then try the mouth tape because you really want to make sure you're able to breathe through the nose.
All right. Then, when you mentioned the MTHFR, I'll direct our advice. I don't direct anybody anymore. I advise our audience and listeners that we just recently had a doctor of pharmacy come on and talk about his work and looking at MTHFR. So there's a whole podcast up on that and what it causes, how do you test for it, what are the methylated vitamins, so alluding to all that. But now you talked about the chewables there. But
Mhm.
what about your Simply Silver oral care line that you've come up with? Does it help with that oral microbiome and the bacteria in there?
Absolutely. So again, we want to be balancing that oral microbiome. Things that are going to disrupt it would be alcohol. So like your number one mouthwash on the market, Listerine, it's 27% alcohol. So that is going to dry out your oral microbiome. It has a pH of 4.2. So if your saliva drops below a 5.5, that's how you can get a cavity. So you want something that's pH balanced, that doesn't have alcohol, that's not going to disrupt your oral microbiome. So my products are all pH balanced. They use colloidal silver, so it's not alcohol and it's not going to disrupt your oral microbiome. It's very cleansing. It's great for really helping to remove the bad bacteria that's kind of creating everything. I have a spearmint, which is it's the green. This is more for people that have dry mouth or cavity issues because it has nano hydroxyapatite in it. And then I have a mint and I have a cinnamon mouthwash. These are more for people that have gum disease issues because they're really formulated for people usually have one of two issues. You're either cavity prone or you're gum disease prone. I feel sorry for the people that have both, but you usually fall into one of those issues. So that's why I created my line because as a hygienist, I'm in the trenches all the time. I know what works and what doesn't work. So these products work. They're non-toxic. They don't contain any bad ingredients in them. They're safe, they're effective, and they're not going to mess up that oral microbiome that's so important.
All right. So we've seen what people should do. I still want to hear more about the feedback you're getting when people actually follow those instructions. Is it the added energy that they're getting? What's the number one thing you hear back from patients that are now properly breathing, properly have proper tongue postures? What's the feedback that you get, Heather?
Yes, I had another patient. Actually, he was the youngest one that I've seen. He was 5 and he was having issues in school. The teachers were saying he had anger problems and his parents took him to me. And I looked in his mouth and told them right away, he's got a tongue tie issue. You need to go see Dr. Lynn. And sure enough, he absolutely did. They did a tongue tie release.
Explain tongue tie. Is that the little
The frenum being
yeah?
too tight to the floor of the mouth. So
Okay.
his airway was compromised. So this poor kid was never getting into parasympathetic. So attention deficit disorder. He just wasn't sleeping, right? Because his airway was compromised. So after the surgery, he's a new child. The parents practically were crying, telling me that they'd taken him to all kinds of specialists. And they were so grateful because in 2 minutes, I was able to find out this child's problem that they'd been, dealing with since forever. So they were so excited and so appreciative. And, this child's going to have a whole different life. I mean, he's back in school. He doesn't have any issues. He's sleeping. His mouth is closed at night. So it's really exciting to hear those kinds of success stories.
Well, thank you
Good.
for sharing.
Thanks.
Mhm.
All right, so we're gonna get close. We're getting close to wrapping things up here in this part one with you, Heather. It's good to have you back. Part two, we're gonna go into, and next month we'll go into sort of outdated dental practices that might be causing people harm to take a look at. So you've shown us really that it's clear that oral health is about much more than just the teeth and the gums and how it impacts the cardiovascular system, how it impacts your posture, your sleep, and your pain, neck pain. So it's very wide reaching and very impactful in that. So when you fix these things, as just you talked about with Breck, you get that entire body benefits and quality of life benefits on that. So, I want to take people back to that nose breathing test we did, and you modified and said you could do it one at a time. So now that one nostril at a time, just for clarity. So, my people, now that they know what they're looking for, check it again tonight before bed. And if it still feels difficult, that's one signal that that airway needs attention. That's could be very impactful to your life. And now they kind of know where to start a little bit.
We love actionable things, right? Something that you can do right now. So, what's the one shift that you want people to make after hearing this podcast?
Well, it would definitely be nasal breathing and, just bring that up to their awareness. Pay attention. A lot of times people don't even realize that they're doing it. Now, you're going to breathe through your mouth while you're talking, but if you're or you're yawning all the time or sighing, well, that's definitely a sign that you're over breathing. So really focus on how you're breathing, taking deep breaths. Your shoulders shouldn't go up when you take a deep breath. Your diaphragm needs to go out. So really just kind of bring your breathing up to a conscious level.
So, Tim, I know that we're going to save a lot of the information for the next episode with you, but I'll go ahead and say that today we've learned the reason why you might be tired. And it's not just your lifestyle. It could be actually your mouth. And so you need to take a look at that. And so, there's some actionable things that we can do today to correct some of those, those imbalances in how we're taking in oxygen. So if you want to feel better, sleep better, and stay focused, it can start with sleeping better tonight. So check your tongue posture and, make sure that your tongue's in the roof of the mouth, like Heather has explained. Keeping your lips sealed, as we've talked about. This has, again, just been part one of a 3-part series that we're going to do with Heather the Hygienist. And so next time we'll jump into more of the toxic traditions that are still lingering in modern dentistry today. So I want to remind all of our listeners, hey, please subscribe to the Wellness Wave Club YouTube channel. You can join us on the Facebook community. Heather's there as well, so you can reach her and ask questions specifically to her there on the Facebook group. And if you enjoyed this episode, please share it with someone that is in your life that may also be struggling with brain fog or fatigue. It may just be from the way that they're breathing. Thank you so much, Heather, for being our guest again today. We look forward to the next episode with you. It's always a pleasure to catch up with you. And to our listeners, remember, wellness, it's in you.